Slowly, Wuhan is emerging. And today, a national moment of mourning to honor the 3,330 people the authorities say have died from COVID-19, and the medics who lost their own lives trying to save others.
那么今天呢，来参加我们市区的同胞战友的这么一个哀悼活动，心情是非常沉重的。那么，我们也一定会化悲痛为力量。现在我们仍然坚守在第一线，我们一定会站好。
Far from nearing the end, Western Europe is still in the midst of it. There are so few beds in France, where nearly 7,000 have died already. Critical patients are being airlifted around the country. Alsace in the east and Strasbourg have been particularly badly hit. When, people ask, will infections begin to slow?
Difficult to say. We're hoping that in our region we've kind of reached the peak, and we are not going to have every day even more admissions than the previous day, hopefully. But that's not the situation everywhere in France, because we've been hit it first. So we're just hoping that now we've been at the highest, and it will slow down.
Both China and the EU are promising assistance to Africa to help bolster fragile health systems, like this isolation centre in Lagos. In Joburg, mobile testing labs began visiting townships. And the entire continent became the focus of some deeply unsettling comments this week, when two French doctors suggested trial treatments should be tested on African prostitutes or people with AIDS.
En Afrique, où il n'y a pas de masque.
One of the doctors has since apologized. In the USA, no apologies, just more contradiction from inside the White House itself, where the Surgeon General issued new safety guidance. Start wearing masks. Something Melania Trump immediately tweeted. But as for the president himself, evidently it's beneath him.
Somehow sitting in the Oval Office behind that beautiful Resolute desk, the great Resolute desk, I think wearing a face mask as I greet presidents, prime ministers, dictators, kings, queens. I don't know, somehow I don't see it for myself.
The US now has by far the largest number of infections anywhere, with deaths predicted to approach 250,000. And projections New Orleans could soon join New York as one of the nation's coronavirus hotspots.
Well, the state of New Orleans, where just a few weeks ago tens of thousands of people crowded into the city to celebrate Mardi Gras, is fast emerging as a southern hotspot of coronavirus in the United States. Cases are soaring and the death rate is twice that of New York. In a state already grappling with high levels of poverty and ill health, officials are struggling to cope. Kate Fisher reports.
Mardi Gras in full swing on the streets of New Orleans, 2 months into a coronavirus outbreak, 35 days after the first US case. It's thought the disease spread rapidly through the crowds, even though at that point there were no reported cases in the state. Oblivious to the risk, partygoers filmed themselves jostling in the cramped streets. 2 weeks later, a dramatic surge in the number of sick shut down the city. The mayor says she would have acted sooner if President Trump had alerted the country to the risk.
In hindsight, if we were given clear direction, we would not have had Mardi Gras, and I would have been the leader to cancel.
Instead, the city and surrounding areas are overwhelmed. The rate of infection in New Orleans is one of the highest in America. The state governors predicted the city will run out of ventilators by the end of this weekend.
It's tough. It's almost like whack-a-mole. Every night, there's a different facility that's overwhelmed, and this ICU's tight. We don't have any inpatient beds at this place, and we're constantly moving around the chess pieces.
The death rate from COVID-19 here is nearly twice that of New York City. Almost a quarter of people in New Orleans live below the poverty line, where a family of four makes less than £22,000 a year. This in a country where healthcare isn't free.
So poverty and poor health are inextricably linked, and many of our individuals in New Orleans are impacted not only by being low income, but by cycles of violence and trauma from early childhood. So all of this leads to the perfect conditions for chronic disease. And what we're learning about this virus is that it is opportunistic and that it is very deadly to people who have multiple organ disease.
Those deaths can be rapid too, meaning families, if they're even allowed to visit, may not get there in time to say goodbye.
We had a 98-year-old lady who tested positive, and she wasn't doing well, but because of her age, she was not going to be ventilated by her choice. So the family was called, but as is so common with this, she just went bad really quickly. You know, it's rough to think that someone who had lived almost 100 years would end up dying with a stranger or relative stranger holding her hand. It's rough.
The concern is that those levees will just get overrun and the city will quickly flood.
This isn't the first time New Orleans hasn't been able to properly mourn its dead. In 2005, Hurricane Katrina claimed more than 1,000 lives.
I think that there's definitely a feeling of a sort of triggering effect. There's people who have PTSD from Katrina. I think a lot of the wounds from that situation haven't really healed for many of us, myself included. I think about Katrina and that situation all the time. And I think that it is sort of one thing after another, and it is very disturbing. I'm from a very poor state. New Orleans is not a very wealthy city, and we don't have a lot of political power nationally. And so I think that that is a real problem. And I think you have to lay that at the feet of the federal government. It is their job to make sure that all the citizens in this country are being supported equally.
New Orleans' lower 9th Ward was washed away by Hurricane Katrina. Those who survived were left homeless and hopeless. But Benel Cotlin was determined to salvage his community then, and he's doing the same now. He set up the only store for miles in the wreckage of his neighbourhood. Now he says those neighbours have lost jobs and he's having to give away food on credit.
These are customers coming here trying to get milk, eggs, bread, cheese, to feed their families. And I can't tell them no, because if they had money, they would pay it. I'm sorry, I just see so much pain every day, and it hurts. It hurts. I wish that I could do more. It is so hard. It's like Katrina all over again. Except this time, it's a lot harder because it's like an invisible monster. It's like a nightmare. That's the best way to describe it.
New Orleans is still trying to rouse itself from the last bad dream it endured. But this scarred city is once again unsure whether it will get the help it needs to treat its wounds.